So a femur, the leg bone, can move in relation to the pelvis, that's this kind of motion. Or the femurs can stay still, and then the pelvis moves on top of the femurs. That's by me just bowing forward and doing this motion here. So it's like I'm closing a book, then opening a book, that kind of motion. So that's a hinge position. This is important to get understanding of if you can't do that. And that's pelvis moving on the femurs. And you would use that with squats, with deadlifts, that sort of stuff. However, there's another problem that can come. Some people have backs, especially old achy backs, that it's constantly stuck in extension. So what that means is the back's always like this. It's always got this curve in the back. Even when they bend forward, so they might look like they've folded forward this way, but when you look here, it's staying flat in this section, or it's even in extension and the rest of the body's bending forward. That's not healthy. A healthy spine should be able to move completely into flexion and completely into extension. It should be able to move in and out of positions. So this next exercise is to help the lumbar spine, with the help of the pelvis, to be able to move in and out of flexion positions. So each segment to be able to move. And the way you can practice is just make sure your feet are flat on the floor. The area where pretty much where your belly button is, shooting, if you imagine that shot through to your back, we want that area to be able to move like this. So the way I get people to understand how to do this, I put my hands on their hips and I ask them to roll their hip forward, and I do this with my hands. I make this motion with my hands as they roll the hip forward. Then as they roll the hip back, I roll it back this way. So you can imagine someone doing that to you. To get movement start to happen in this area, so the lumbar spine area. Or you can think about the ASIS landmark here like flashlights, and as I arch my pelvis forward, the flashlights are pointing down. As I roll my pelvis back, the flashlights point up. So some people find that very useful to understand. So there's that motion there. And how to get good feedback with this. You get a power band, just a thin one. You can use a TheraBand with this too. And you're popping it on just above the hips, so it'll be about the L4 level, keeping some pressure here. And I'm just resisting that. So we're just focusing on where the band is touching, so it's giving me the proprioceptive feedback. And I'm pushing that vertebra back, then letting it arch, pushing it back, letting it arch. Should be absolutely no pain with this at all. If there's pain, you have to regress and do some other things first. So I do maybe 10, then I come up about 2 to 3 centimeters, about an inch worth, and that'll be the next vertebra. So I'm on about L3 now. I'm keeping this pressure, and I want the area where the band is touching now, I want to push that back, just that segment, let it arch, do about 10, come up another inch or so, about 2 to 3 centimeters. That'll be about L2 now, push back at that region. And the whole lower back will move, but the focus is on right where the band is touching. So we want that area, particularly want that part, that segment to move until you get up to about this level here, which would be about the T11 phase. Once you can do that, going into this is another way to practice. So the same thing, just looping that around, just sitting back on the heels. And I'm doing the same thing here. And it's a neurological exercise. I'm aiming to connect with my body a lot more and make that particular segment really prominent in my mind, and I can move that segment, go up a little bit higher. You can also practice in this position too.